in the gilded corridors of 18th-century European power, where monarchs commanded nations and shaped the fate of millions. One unavoidable truth remained: the human body, regardless of title or throne, answers to forces beyond any sovereign's control. Frederick William I of Prussia, the architect of one of Europe's most formidable military machines, would face his final campaign not against rival armies, but against his own failing organs. His death in 1740 stands as one of the most thoroughly documented royal medical crises of the era, offering historians a stark window into both the limitations of contemporary medicine and the universal vulnerability of human physiology. When Frederick William I assumed the Prussian throne in 1713, he inherited a kingdom that occupied a modest position among European powers. His father, Frederick I, had devoted considerable resources to cultural pursuits and courtly magnificence, establishing Prussia as a center of artistic refinement. The new king immediately demonstrated radically different priorities. Within his first year of rule, Frederick William I began systematically dismantling the elaborate court apparatus his father had constructed. Musicians, artists, and philosophers found their royal patronage withdrawn. Every available resource was redirected toward a singular vision, transforming Prussia into a military state of unprecedented efficiency and power. The scope of this transformation proved remarkable. Frederick William I expanded the Prussian army from roughly 38,000 soldiers to more than 80,000, establishing the fourth largest military force in Europe despite Prussia ranking only 13th in population and 10th in territorial size. This achievement demanded far more than military expenditure. It required a fundamental restructuring of Prussian society itself. The king implemented comprehensive systems of military service that bound both nobility and commoners to the state's martial needs, creating a culture where military values penetrated every level of civic life. He personally oversaw training exercises, designed uniform specifications, and developed tactical innovations that would prove decisive in Prussia's future conflicts. His dedication to military discipline extended into every aspect of his personal existence. Frederick William I wore simple military dress rather than ornate royal garments, consumed plain fare, and maintained a daily routine of almost mechanical regularity. This rigid temperament shaped his relationships, particularly with his eldest son, the future Frederick the Great, as the prince displayed growing interest in philosophy, literature, and music rather than military affairs. Father and son found themselves in increasingly bitter conflict over the proper duties and character of Prussian royalty. Yet beneath this image of martial vigor and iron discipline, troubling symptoms emerged earlier than contemporaries anticipated. From his mid-30s, Frederick William I began experiencing recurring episodes of urinary difficulty. Medical records from the period described these initial manifestations as uncomfortable sensations and problems with normal urination. The king initially attributed these symptoms to the physical demands of military life and campaign rigors. Physicians of the 1720s possessed limited diagnostic capabilities, relying primarily on humoral theory, the ancient Greek medical framework that still dominated European medical practice. As the 1730s progressed, these urinary difficulties escalated from intermittent discomfort to episodes of severe pain. By the decade's end, Frederick William I endured attacks of such intensity that palace servants could hear his cries throughout the royal apartments. The king, who had built his reputation on stoic endurance and military bearing, found himself writhing in his chambers, desperately attempting to urinate for hours while achieving minimal relief. Contemporary accounts describe him trying various physical positions, seeking any posture that might ease the obstruction, often producing only drops or nothing despite excruciating effort. Royal physicians, recognizing the severity of their sovereign's condition, consulted the most advanced medical literature available and corresponded with medical practitioners across Europe. They increasingly suspected kidney stones combined with severe bladder inflammation, according to the prevailing medical understanding. Such stones formed when bodily humors fell out of proper balance, causing minerals in urine to crystallize and accumulate. Physicians identified various potential contributing factors in the king's case: his preference for rich meats and baare, his volatile temperament, and the alternation between intense military activity and sedentary administrative work. The treatments prescribed reflected the era's medical limitations and often proved counterproductive. Physicians administered powerful purgatives designed to cleanse corrupt humors, subjecting the king to violent digestive episodes that compounded his misery without addressing the underlying urinary obstruction. They imposed restrictive diets intended to prevent stone formation, though different physicians often contradicted each other regarding which foods to eliminate. Herbal preparations became constant fixtures at the royal bedside, bitter concoctions promising to dissolve stones or facilitate their passage, yet rarely delivering meaningful improvement. As these gentler approaches failed, physicians escalated to more aggressive interventions that would shape the final chapter of the soldier king's life. When conservative treatments proved inadequate, royal physicians resorted to increasingly invasive procedures that reflected 18th-century medicine's desperation when confronting serious urological conditions. Bloodletting, considered a universal remedy for severe ailments, was performed repeatedly on the suffering monarch. Surgeons opened veins in his arms, removing substantial blood quantities under the theory this would reduce inflammation and restore humoral balance. The king, already weakened by chronic pain and declining nutrition, found himself further debilitated by these blood removals, growing progressively paler and more exhausted. Perhaps most traumatic were the catheterizations attempted with the crude instruments available in the 1730s. These devices bore little resemblance to modern medical catheters, consisting instead of rigid metal rods or tubes that had to be forced through the urethra into the bladder, without anesthesia, antiseptics, or understanding of sterile technique. These procedures became ordeals of extraordinary suffering. Strong attendants held the king down while physicians attempted to navigate metal implements through his inflamed and obstructed urinary tract. The sounds of these sessions became dreaded by everyone within earshot of the royal chambers. Modern medical analysis of historical records suggests these repeated catheterizations likely worsened Frederick William I's condition significantly. Each insertion risked tearing delicate urethral tissues, creating new injuries atop existing inflammation and scarring. The absence of sterilization meant infections frequently followed these procedures, introducing complications that compounded the original obstruction. What began as kidney stones and bladder inflammation deteriorated into a cascading series of complications, with each medical intervention potentially adding further damage to already compromised organs. By early 1740, the king's condition demanded continuous medical attendance. He could no longer maintain the rigorous schedule that had defined his reign, finding himself confined to his chambers for extended periods. The military reviews and drilling sessions that had brought him such satisfaction now occurred under subordinate direction. Court business slowed dramatically as ministers struggled to obtain royal attention for necessary decisions. The suffering monarch, often too consumed by pain to focus on administrative matters. Physical changes in the king's appearance alarmed regular observers. His abdomen began swelling visibly as his bladder, unable to empty properly, distended far beyond normal capacity. Courtiers who had known Frederick William I as a robust man of martial bearing now witnessed his midsection transformed into a pronounced protrusion straining against his nightclothes. When physicians examined this swollen area, even gentle pressure produced waves of pain intense enough to cause loss of consciousness. The psychological impact of this prolonged suffering proved equally devastating. Frederick William I, accustomed to exercising absolute authority and maintaining iron self-discipline, found himself utterly powerless against his failing body. Witnesses described how he alternated between resigned despair and explosive rages, sometimes blaming physicians for incompetence, other times accepting his fate as divine judgment. During brief periods of reduced pain, he attempted conversations with his son about succession matters, seeking some reconciliation after years of conflict. These exchanges, conducted while fighting constant discomfort, provided poignant moments during his final months. As spring 1740 arrived, physicians recognized they were no longer treating an illness with hope of recovery, but attempting to ease a dying man's passage. The king's skin developed a yellowish discoloration that modern medicine recognizes as jaundice from liver dysfunction. Though contemporary observers interpreted this through humoral theory as corrupt substances spreading through the body, in reality, toxin accumulation from kidney failure was poisoning his entire system. Medical attendants noted an unusual odor emanating from the king's body during his final weeks, an acrid smell suggesting his bladder had begun leaking, allowing urine to seep into the abdominal cavity. This development introduced infection and inflammation that added sepsis to his already overwhelming burden of afflictions. Historical accounts indicate the bladder wall, weakened by chronic distension and medical trauma, eventually ruptured completely, flooding the abdominal cavity with accumulated urine and triggering peritonitis. Physicians administered opium preparations in increasing doses, the era's most effective pain relief, bringing periods of semi-consciousness where suffering receded to more bearable levels. These medications also produced vivid hallucinations. The king sometimes believed himself back on parade grounds, drilling troops, other times conversing with deceased family members, alternating between quiet moments and sudden episodes of delirium. Frederick William I of Prussia died on May 31, 1740, ending months of documented medical crisis. His passing concluded a reign that had transformed Prussia into a military power, establishing foundations his son Frederick the Great would build upon. Yet the soldier king's final ordeal revealed a truth transcending royal status: the vulnerability of human physiology to conditions that contemporary medicine could neither properly understand nor effectively treat.